I'm just gonna verify the provider's orders in the patient chart. It looks like we have an order to place an NG tube, so I'm gonna go gather my supplies for that. And an NG tube, NG strips, tape, lubricant, a basin with a syringe, pH strips, cup of water with a straw, a towel, and some tissues. So I'm just gonna perform hand hygiene. Hi, can I verify your name and your date of birth?
Yes, Therese Letterman, November 30th, 1970.
Okay, perfect. My name is Avery. I'm going to be your nurse for the next couple hours. Looks like we have a provider order in the chart to place an NG tube. That's a tube that goes through your nose down into your stomach so we can test gastric content and things like that. Is it okay if we do that today?
Yes.
Okay, perfect. I'm just going to raise the bed so that the procedure is a little bit easier. Put it at my waist level. I'm also going to raise the head of the bed to high Fowler's position. Just want to make sure you're comfortable there. I'm going to be placing this towel over your chest just in case any gastric fluid comes up, so that you're protected there. And then I'm also going to give you some tissues on this left side in case you need them throughout the procedure or after. You can just go ahead and grab them, okay? I'm just gonna go prepare and organize some of my supplies. All right, so I'm just gonna check the patency of your nares. So I'm just gonna have you cover one nostril and breathe in and out for me. And then the other side. Okay, perfect. It sounds like this right side is a little bit more clear, so that's the side we're gonna be using. I'm also gonna just measure the tubing to make sure that you have the right length, kind of know what to expect. So I'm going to measure from the tip of your nose to your earlobe and then down to your xiphoid process. Okay, great. That looks to be about 65 centimeters. So I'm just going to measure that off with some tape. Okay, now that that's measured, I'm just going to perform hand hygiene and put on some gloves for the procedure. Okay, first thing I'm going to do is I'm going to lubricate the first 3 to 4 inches of the tubing with some surgical water-based lubricant. Awesome. Then I'm also going to hand you this cup and straw. I'm just going to have you hold on to that for me for a second. Don't take any sips yet, but when I tell you to, take a sip of water each time, and it'll just kind of help the tube move down the correct tube and also move down a little bit easier, okay? So I'm just going to cap this. All right, I'm going to start here. 1, 2, 3. Awesome. Okay, now tilt your head to your chin, or your chin to your chest, and take a sip for me.
Gulp.
And again.
Gulp.
Again.
Gulp.
Perfect. Keep going.
Gulp.
Sip. Sorry, I just need to move back a little bit. Take another sip for me.
Gulp.
Sip.
Gulp.
Sip.
Gulp.
Sip.
Gulp.
Sip.
Gulp.
Sip.
Gulp.
Sip.
Gulp.
And last one.
Gulp.
Awesome, you did great. Okay, I'm just gonna be placing some tape here so that it can stay put for a second. Okay. Just gonna anchor that to your nose temporarily. Okay, awesome. All right, now I'm gonna just check the gastric content. So I'm gonna remove this and pull back 5 to 10 milliliters of gastric fluid. Okay, I'll cap that back on. So I'm just gonna mix it. It looks like it's about a green-brown consistency. I'm gonna put that into the basin and check that just to make sure everything's looking good. Okay. All right, according to the chart, it looks like it's about a 3 or a 4, which is normal, so that's great. I'm gonna secure this to your nose using one of these NG strips. I'm just gonna put this over the bridge of your nose and then around the tubing. Great, okay. Now that that's secure, I'm just gonna attach you to suction. So according to the doctor's orders, we want it to be at low, so I'm just gonna turn it to continuous to check that. Okay, and then I'll connect this to suction. Perfect, and turn it to intermittent. Awesome. Now that that's connected, I'm gonna attach this to your gown and anchor it so that you'll be able to move and not have to worry about it pulling or anything like that. Okay, I'll take that cup from my CNA, thank you. Awesome, and then I'm just gonna lower the head of the bed to make you a little bit more comfortable. I do need to keep it above 30 degrees. Is that okay for you?
Yep.
Okay, awesome. I'm also gonna lower the bed to keep you safe. Make sure that the bed is in a low position. Keep one side rail up. If we have two, then it would kind of be a restraint. We have the one up, the brake is on, and your call light is here on your left side as well. Just press that red button if you need anything, okay?
Okay.
I'm just gonna dispose of some of my stuff here. Okay, I'm just gonna dispose of my gloves as well. Perform hand hygiene. I'm gonna go document this procedure. If you need anything, just press that call light, okay?
Okay.
Okay.